down to just 71. 40 of those cases are in the far north, 8 in the north, 18 in the south region, 5 in Saskatoon, and currently we have no active cases in Regina or in the central region. Today we are expanding the opportunity for family members to visit their loved ones in hospitals, in long-term care facilities, as well as in group homes. As you know, there have been many restrictions and guidelines put in place to protect Saskatchewan residents, our family members, throughout this pandemic. And this one may have been the toughest to balance. On one hand, we all know how important it is for patients in hospital and our parents and our grandparents in long-term care homes to have the support of their family. And on the other hand, we also know that the most dangerous and deadly outbreaks in Canada and elsewhere have been in health facilities, in particular in seniors' homes. So it was absolutely crucial that we protected the patients, the residents, and the staff in each of those facilities. And that's why we brought in some fairly restrictive visitation rules some time ago. And I would say that it has worked. We have not been hit by the kinds of outbreaks in our seniors' homes in Saskatchewan as we have seen in other places. But at the same time, we understand how hard it has been for seniors and their families not to be able to visit in person. So today we are loosening those restrictions to allow more in-person visits, while at the same time we are making every attempt to continue to protect our patients, to protect our residents, to protect our family members, as well as to protect the staff in these facilities from the spread of COVID-19. So starting on July the 7th, 2 family members or support persons can be identified to visit and support patients and our residents. Only 1 family member or support person can be present in the facility at a time. 2 people can be present at one time for maternal services, for critical care services, intensive care, or palliative care patients. Additional family members or support persons may be identified for end of life, for palliative and intensive critical care as outlined in the Saskatchewan Health Authority Family Presence Guidelines. I'm pleased that we are able to allow more opportunities to visit family and loved ones in these facilities, while still ensuring that every precaution to keep patients, residents, and our staff safe is in place. Finally, I just wanted to take this opportunity as we move into yet another great Saskatchewan summer weekend to remind everyone in this province to keep doing all of the things that you have been doing, all of the things that have gotten us this far. The physical distancing, the washing your hands and using hand sanitizer, not sharing our food and drinks, staying home if you have any symptoms at all. These good habits, well, they are working here, and they will keep working if we continue to practice them. With our case numbers remaining low and almost everything now reopened in Saskatchewan, there is the danger that we could become complacent and start to maybe forget a few of these good practices. I would ask that we don't let this happen. Today in the United States, we are seeing record numbers of new cases. I don't know precisely why this is, but it seems like in some places, as they reopen sectors of their economy, many people went back to their old habits. And now we are seeing how a few cases can turn into a few hundred cases and into a few thousand cases, and very quickly as if we are to let our guard down. So to everyone here in this province, let's please be careful. Today we can do almost everything that makes life great in Saskatchewan. We can go to work, we can go to restaurants, we can visit friends, neighbors, and family. We can go camping, we can go fishing. We can do practically everything that we once did. We just have to keep doing it just a little bit differently. So let's keep doing just that. Let's keep ourselves safe. Let's keep those around us safe, in particular our family members, and let's keep Saskatchewan safe. Thank you again, everyone in this province for what you have done. And I'll turn it over to Dr. Shahab for some comments.
Thank you, Premier. So I'll just reinforce that while our overall cases remain low, we have now seen, after many weeks of no cases, 4 cases in the last 1 week in the Prince Albert area. And I think this is the kind of and the cases are not linked to one another. So when you have a case in a household member and 3 additional cases in close contacts, we almost expect that you will see cases in close contacts, and that's a lower level of concern. But when you see cases in a certain geographical area that are not linked to one another, that's always a flag that that shows that there's ongoing community transmission that is now emerging. So while the precautions that we should take all the time apply to everyone all the time, I think definitely a message for residents of the Prince Albert area is that if you have symptoms, stay home. Consider getting tested by calling 811. Even if you don't have symptoms and you're planning a get-together or a gathering, be considerate of who's coming. Maintain that physical distancing in terms of how you're laying things out. Even if you are meeting within your virtual household, be especially considerate of people who may be at higher risk because of age or underlying comorbidities. I think we need to watch very closely whenever we see cases emerge in settings where in the past there were no cases, and right now I think there's a bit of a concern for the Prince Albert area, and we'll have to keep monitoring and observing extra precautions throughout Saskatchewan when something like this emerges, and hopefully, as we saw in the spring, our own actions can really flatten the curve. So everything we do throughout Saskatchewan, and especially in the PA area, in terms of being a bit more conscious about maintaining that physical distance, a bit more thoughtful about should we have a gathering, how big, how many people, do we have enough space, and how we'll all sit and engage with each other in that gathering. Can we maintain that physical distance? I think it's going to be very important for the next few weeks and months.
Perfect. Thank you, Premier. Thank you, Dr. Shahab. As mentioned, we'd like to do COVID questions first if we could. So Dr. Shahab can lead by 3:25. With that being said, we'll take our first question from the line.
We have Zach Becerra with the Star Phoenix.
Hi there, Dr. Shahab and Premier Moe. Some affiliate long-term care homes have told me that they would like to see more visitor opportunities, but one concern they have is adequate staffing. They say that it takes more staff sometimes to properly screen everyone and make sure PPE is being properly used when these visits are happening. What steps, if any, are being taken to make sure that homes can actually take advantage of this opportunity to make sure seniors can see their loved ones again?
So there have been some specific adjustments that have been made around staffing, especially the fact that staff are cohorted to specific facilities, so they know the people who are visiting and residents well. And it is an additional level of complexity when staff as well as visitors have to be screened, and where appropriate have to use appropriate PPE. And of course, visiting outside the facility in summer, for example, is a safer way to visit, but that also needs extra resources. But the SHA can speak to further about how that impacts the enhanced visiting policy. But certainly there is that extra caution requires both staff to take extra steps, but also visitors to be conscious of not visiting if they're unwell, if they've been exposed to a high-risk situation till 14 days are over, and also complying and making it easy for staff to support that visit, even as the restrictions are opened up a bit.
Do you have a follow-up question, Zach?
I do, yes. Dr. Shahab, you mentioned earlier there that we saw a case in Prince Albert that is linked probably to unseen transmission. If we see an outbreak of some kind in a region, is it possible that these visitor guidelines might be rolled back, that we might have more restrictions on visitors in that area?
Yeah, that's an excellent point, actually, because we have to now actually be very flexible as we move forward. So right now, overall in the province, COVID transmission is low enough for visitor policies to be relaxed. But even there, we need to be still very cautious, especially when we're visiting in long-term care facilities and personal care homes, because we know that even when COVID transmission is low, introduction of COVID into those settings can have very significant consequences. But certainly when if there's an outbreak in a local area or transmission increases, and right now there's a caution for Prince Albert, we have to watch that. But if in the future there's increased transmission in a particular community, then extra precautions may include slowing down, or reconsidering visitation to long-term care facilities, and also, reconsidering other activities we may be planning. For example, reconsidering having that large gathering you were planning. I think we all have to be aware of what's happening locally and to reconsider what we were planning, even socially, and be more conscious of things that we practice all the time. But if there's a local outbreak or increase in transmission, just being more conscious of that, maybe considering using a mask when visiting, in an indoor environment where you can't maintain 2-meter distance. I think those are the kind of things we'll all have to be aware of as we move forward.
We'll take our next question on the line.
We have Mark Smith with CTV.
Hello. In the expanded visitation guidelines, it says masks will be required, medical grade masks. Are you confident that there are enough masks in the supply system to account for increased visitors?
So at this point, they are available for visitors, and it is important that that it's not just being available, but visitors have to be able to use them properly. But at this point, there is enough PPE to support both safe patient care as well as safe visitation.
Follow-up question, Mark?
Yes. The South region has only seen one new case in the past 8 days. Is that outbreak in the Maple Creek region now under control?
So there's been lots of work that has been done by local public health and community leaders to make sure that testing is available for anyone who is symptomatic. Usually it does take 2 to 4 weeks with no cases to be comfortable that the outbreak is over. But certainly what we have seen from other jurisdictions is that we can be confident that the outbreak is under control, and we expect to see a lower number of cases going forwards.
We'll take our next question on the line.
We have Alicia Bridges with CBC.
Hi. My first question is about a press release earlier this week that mentioned fall planning for post-secondary institutions. I'm wondering what advice public health is giving to these campuses, and if you're aware of any that will be running in-person classes starting in the fall.
So generally, the Ministries of Advanced Education are working with universities to develop their plans for the fall semester onwards. And similarly, the Ministry of Education is working with schools to plan for elementary and high schools starting in the fall. Universities have specific plans that lay out processes in more detail. So even in the spring and summer, universities are still active. For example, there's postgraduate research, lab work, people who had to complete their examinations or practical examinations. They are still occurring in a safe manner. So universities have, re-looked at their routine business just like everyone else, and they have enabled, postgraduate education, especially at the master's and postgraduate level, to continue to essential lab work and research to continue in a safe level. But in the fall, my understanding is there'll be a hybrid of online and in-class learning, but all in-class activities will be done in a safe manner. And the basic principles of that, of course, is that, like in everything else, you maintain physical distancing as much as possible. If you are participating in in-class learning, you try to sit in the same seat and have the same group of students at an appropriate distance, so that in the rare instance that there is a case of COVID-19 transmission, contact tracing is simpler. So the principles that apply for all of us going back to work are the same principles that apply to university setting. And of course, school settings are different because there, you have a smaller cohort, which is more of a fixed cohort in terms of a class with a fixed number of students and fixed number of teachers. So elementary schools are a bit different, and high schools are a bit of a hybrid between elementary schools and universities.
Do you have a follow-up question, Alicia?
Yes, thank you. We're hearing questions from the community about why liquor stores in most places stayed open to avoid withdrawals and to help people who are addicted to alcohol when other addiction support services were shut down or limited during the pandemic. Can you explain why?
So, when we went into lockdown and when non-urgent health services were also reduced, it was a big challenge for all important services, including access to mental health and addiction services. But very quickly there was some specific steps that were taken where access to mental health and addiction services was initially allowed online where that was appropriate, and then there was a fine balance between obviously allowing liquor sales, but also allowing access to other programs that can support people with substance use disorders, including alcohol dependency. So it has been a fine balance. There has been good success in some jurisdictions with sustained outbreaks, like in the Northwest. But this is an area that has to be monitored very carefully, and it's not just issues related to alcohol. Saskatchewan, as well as many other provinces, have seen challenges with anxiety, depression, other substance use issues, including, unfortunately, overdose deaths due to illicit fentanyl. So all these challenges, I think, were brought into sharp focus during the pandemic, and they need the same attention that other urgent and emergent clinical needs are getting as part of the health service resumption plan.
Perfect, thank you. Those are all the COVID questions that we have for now. If there is anything further, please let us know and we can certainly follow up afterward. So we'll let Dr. Shahab go and then we can move into session questions. So we'll start with Murray.
Mr. Premier, your predecessor, Mr. Wall, used to talk about the end of session and how occasionally we needed to elevate the behavior, language, professionalism in place. We had a kind of a bad 14 days where we ended up with the health minister of all people suggesting that the opposition were glad to see, would have been glad to see more COVID cases. Do you think you have a responsibility or a role, either going forward in the summer or after the election, to do something to elevate this kind of conduct or to prevent this kind of conduct in the future?
There's a number of things that happened this session, and I think there's likely a number of members that were not proud of what they had done up to and including the leader of the opposition, obviously members on our side as well. Yeah, we do. We do as leaders. Myself, the leader of the opposition, as well as ministers, and all of us as leaders in our respective constituencies. We do need to continue to strive for not perfection, but strive to be better in the House and in our communities that we represent. So certainly, I bear some of that responsibility.
What can be done, sir, as a follow-up? There's some people online who are calling for Mr. Ryder's firing over this, and I don't know if that's appropriate, but certainly there's a good argument that there's just not enough punitive action taken by the Speaker or otherwise when people are misbehaving. Should they be barred from the House for a day? Would there be something that you think would be more appropriate?
Well, I don't believe the minister was not out of line with his use of parliamentary language. There was no sanctions in the House, and that is over a century, many centuries of parliamentary standards and guidelines that we follow. Some of them written, some of them unwritten. But with respect to your original question around how we conduct ourselves in the House, we constantly need to strive to do better. This isn't the first time, for sure, even this session, that someone has maybe stepped out of line to some degree, and I would just say that we just continually as individuals need to strive to do better, and myself as a leader, and I would hope the leader of the opposition as well, who was embroiled in his own controversy this session with his conduct. I think there's room for both of us to strive to be better.
Go to Arthur.
It seems like the NDP really focused on fears of a supposed hidden agenda this session, and I know that you've come back saying that that's utterly false. But there still seems to be a lack of clarity about what's coming after the election. And I know that you said that we're going to have a debate about this during the campaign, but I just want to ask you to use this time right now to be as clear as you can with the voters about what's coming over the next few years in terms of fears that people have about cuts, crown sell-offs, these well-worn subjects that the NDP always focuses on. What can you say in the clearest possible terms about what's ahead on those subjects?
So the lack of clarity that should be referred to is the lack of clarity that we all have, not only in Saskatchewan, across the nation of Canada, but around the world, on where our economic fortunes lie as we look out into the months ahead, post-COVID pandemic. That's the lack of clarity that we globally share right now, is no one knows for sure where our global economy is, how it is going to come back, how robust it is going to come back, and to what level it is going to come back to. We feel our fortunes in Saskatchewan are strong in being a part of that global recovery because of the products that we have in potash and uranium, in agri-food products, in the manufactured goods that we have. That's where the uncertainty is, and we share that uncertainty with everyone across Canada and around the world. Where there is no uncertainty is what this government what this government's intents are post the election, pre the election, what our intents have been for the last dozen years that we've had the honor to serve the people of the province. There's going to be no selling off of Crown corporations. There's going to be no cuts. We have a pandemic deficit here. We may have a couple of pandemic deficits, albeit some of this is going to fall off into next year. Hopefully, and for sure, for certain, we will see some of the expenses that we have to support businesses, the self-isolation support, that will fall off next year. The revenue lines is where the uncertainty lies. So what the people can count on seeing from this Saskatchewan Party government, if we have the honor to form government once more, is more of the same. Investment in schools, investment in hospitals, investment in our highways, investment in our communities across this province through the municipal revenue sharing program, as well as most recently in this $2 billion infrastructure stimulus, the municipal and economic enhancement program, which has only happened twice, both times under this government. That's what the people of this province can expect. What they can expect is a government that is striving to answer the question that is on many people's minds in this province, is who is best to assist in recovering the economy here in Saskatchewan. That's why we made the infrastructure investment. That's why we've made the investments in people and in small business post-COVID. That is the question that is on people's mind, and that is the question that we are looking at as we make the decisions in the days ahead.
Follow-up, Arthur?
Yeah. So you've used the word intent, and you've said that before in terms of taxes. So no intent to raise taxes.
No.
No intent to sell off crowns.
No.
No intent to make cuts. But it seems like all of that is dependent on this recovery that you clearly have a lot of confidence in. You said that you have faith that the people will come through. But obviously, like you've also said, that depends on the way that the world economy goes. So what if the worst happens? What if there is no significant recovery over the next 2 years? Could you just be upfront about what is on the table to fill that gap?
I don't think anybody can, Arthur. I don't think anybody can say, where are we going to be in 2 years? We're answering hypotheticals here. What we need is to manage the next number of months and the next number of years, whoever forms government here in not only Saskatchewan, but we're likely looking at a federal election before too long as well. And so there's that conversation that needs to happen as well. If you could tell me where the global economy is going to recover to and to what level that global economy is going to recover, we could really then have a very formidable conversation around how the Canadian economy will recover and how the Saskatchewan economy will recover. We have faith that it will, but we have faith that Saskatchewan can participate in a great way of that because of the products that we have. We don't feel that there is going to be a reason for increasing taxes. We don't feel there's going to be a reason for any of the things that the NDP are talking about. quite frankly, because we have faith in the Saskatchewan people that they'll be able to recover. Part of that is already occurring. We didn't shut our economy down here in Saskatchewan near to the level of other areas of Canada, and I've spoken to that before. We also opened it up in a very methodical fashion with our Reopen Saskatchewan plan, which is a very comprehensive document on providing guidelines for how we can do what. The entire intent of that document is, yes, to keep Saskatchewan people safe, but the secondary attempt is to ensure that we don't have this second wave so that we can continue to keep these sectors of our economy open. We're seeing in other areas that that isn't happening, and they're having to make some very difficult decisions for a second time. There's a lot of unknowns when it comes to the COVID-19 virus.
You do know roughly what the annual expense increase is roughly, because you've been pretty consistent that way, actually, is government. What you don't know is revenue.
No, the variables of revenue, right?
Yeah.
And I think we saw that in this budget that was introduced.
It was ridiculous, quite obviously, in terms of the revenue drop that you had, but
it's the only estimate of revenue drop that has been introduced in the nation of Canada.
If we have a revenue recovery at all, or if we have a certain revenue recovery, wouldn't that be fair to the voters if you said, if we don't have a revenue recovery to a certain point, if we don't have a revenue recovery to whatever levels in 2019, then we might have to proceed? Is that not an unfair?
Well, if we don't have a revenue recovery by next spring, next summer, I think we have much larger challenges around the world. Those challenges in Saskatchewan are going to look quite small. And the challenges that we've had here thus far, I would say, are somewhat smaller than they are in other areas of the world. And much of that, virtually all of that, is due to two things. The advice that this gentleman that just walked out, Dr. Shahab, has provided the Saskatchewan people, and the fact that Saskatchewan people have adhered to that advice. Our numbers are low. Our impacts have been less than other areas, albeit very severe. Our impacts in this province have been severe, and I'm not denying that, but they have been less than other areas of the nation. And if we can continue on that trajectory, whatever the impact is globally, it should be less here in Saskatchewan. And as we start to recover globally, we should be able to be a larger than our portion of that as we recover globally. Saskatchewan is poised to be in a very good position to not only recover our economy to where we were pre-COVID, but actually grow it beyond that. I truly believe that. And when you add in investments like we saw announced here yesterday with respect to starting to bring some double the irrigable acres here in the province, that's when you really start about not only getting back to $30 or $31 billion in exports, but starting to look at 35, 40 billion in the years ahead.
Steph?
Yeah, Mr. Premier, how many years are you willing to wait, provided you might win another mandate? So how many years are you willing to wait before, when it comes to the recovery on the revenue side, before you would consider having to raise taxes here?
I wouldn't be able to answer that question. What I would say is this year we're going to run a deficit. Quite likely next year we're going to run a much smaller deficit, and we will ascertain likely at the first quarter report as to what we may have a little better idea at the first quarter report here in August with respect to some of the projections going out into next year. And that is really going to help us as to determine what the economic recovery is doing, how it is impacting Saskatchewan's fortunes, and how long it may or may not take us to get back to balance. The fact of the matter is two things again. One, there's one jurisdiction in this nation that has introduced and passed a budget now. That's Saskatchewan. The federal government has not. No other province has since the COVID pandemic. I believe Alberta passed theirs just previous in 3 hours, I think was the debate time that the NDP had agreed to with the UCP party in Alberta I believe it was in early March. But we see even a province like Alberta looking at $15 to $20 billion deficit potentially. Proportionately, that the 2.4 that we have in Saskatchewan would equate to 9 or 10 billion in Alberta by per capita. We hear Manitoba looking at $3 to $4 billion in deficit. Again, we're below that per capita here in Saskatchewan. So I think we're in a very strong position, not only today, but in a very strong position as we entered this pandemic with the fiscal condition that we were in, and that was due to some very challenging decisions that were made 3 years ago in this province. The structural essence of our budget is solid as anywhere in the nation. The deficit that we're experiencing is due to the same factors that virtually every other province, territory, and the nation of Canada is experiencing a deficit, and that's due to the response to COVID.
Follow-up?
Yeah, so if you are so confident that Saskatchewan's finances are stable, that we are going to recover on the revenue side at some point, why won't you rule out raising taxes if you secure another mandate?
Why wouldn't I?
Why won't you rule it out?
The full intent is to not raise taxes. We made our decisions 3 years ago. There is no intent to raise the taxes in this province. We made our decisions 3 years ago where we made some changes to a number of different areas of not only taxation but spending and investment in the budget. We feel that we corrected the structural challenges that this budget has. And you know, we're fully confident in the recovery of the economy here in the province. We're fully.
Intent isn't the same thing as saying you won't do it, though. You know there's a difference.
Well, you tell me where the global economy will be in 2 years.
Well, it's hard to do both. It's hard to say how can you express confidence that the economy is going to recover?
Right.
But then say there's a lot of uncertainty, but then say the intent is to not raise taxes. What I'm asking is, if you are confident Saskatchewan can recover, why don't you just rule out raising taxes instead of kind of dancing around it with the intent?
I've said what I've said. I'm absolutely confident that the economy in this province will recover. The global economy needs to recover so that the Saskatchewan economy can recover. We are committed to running a deficit this year like virtually every other province and territory, as well as the federal government in this nation, and I suspect many other nations around the world are doing the same. This is a time of unrest. This is an unprecedented time. I don't think you can ask anyone if they're going to raise taxes 3-4 years down the road. We may not form government after this October. The expectation is that we will, and our full intent is to bring forward a recovery platform that will build on the platforms that we have already, our Reopen Saskatchewan, our growth plan, as well as this particular budget, to bring that forward this fall to fully cost those investments that we may commit to in this election campaign this fall. We would ask that the opposition would do the same and fully cost their platform, and then it will be pretty simple math as to who will or will not have to look at raising taxes. It's our intent not to. We'll bring forward a platform that ensures we don't have to, and that's all to be discussed over the course of the next 2 or 3 months here.
Mickey?
The MLA for Arm River stood up in the House today, and during his final words, he said all lives matter. Is this the viewpoint of the government, that all lives matter?
No, I believe that would be the words of an outgoing MLA in the House here today. There was a number of outgoing MLAs that made speeches here today. I've made my comments with respect to systemic racism and racism here over the course of the past couple of weeks. So those would be his comments.
Do you condemn those comments in the House?
Those comments shouldn't have been made in the House. It shouldn't have been made by the individual due to the controversy of this conversation, and they're just not helpful to where we are going as a society and the conversation that we are having as a society.
And it looks like Edmonton might be the hub for the NHL playoffs. I was just wondering, do you think that this increases the Oilers' chances of winning, or were they always going to beat the Maple Leafs anyway?
Yeah, well, the Maple Leafs are no problem for our Edmonton Oilers, led by Connor McDavid. They've been a successful franchise for decades now. It is the city of champions, much like Regina is in the case of the CFL. We do look forward to hosting the CFL if we're able to salvage some season here in Regina and retake the cup that so rightfully deserves to be in this city.
We'll take our next question on the line.
We have Lisa Schick with CJME.
Go ahead, Lisa.
Premier, I'd like to just get your impressions of the last 3 weeks. Were they particularly good or bad? Were there any highlights from session?
No, I think in general, the last 3 weeks were good. From the government perspective, we were able to pass our legislation that we had on the air order paper, which is important for us to be doing the work that the people of this province expect us to be accomplishing. We were also able to introduce and pass a budget. And again, I'd say one more time that it is, this Saskatchewan is the first and only jurisdiction to introduce and pass a budget with full legislative scrutiny here in this nation. The Saskatchewan has been very forthcoming in our response to COVID-19 and the financial impact of that response on the government of Saskatchewan. Yes, there are many questions as we move forward. Those questions, in fairness, are for all of us as leaders across Canada, provincial, territorial leaders, as well as the nation on what are the long-term impacts of our response to COVID-19. I feel we've minimized those impacts here in Saskatchewan. I'm concerned with the amount of dollars that have flowed from the federal government, and when we talk about the potential for raising taxes, there's a far greater chance that our taxes will be increased from the federal level due to the close to doubling of their budget just this particular year. But I am happy with the outcome of the session, passing our budget, passing our legislation. I believe it's a good budget for the people of Saskatchewan. It's one that we're willing to put to the people of Saskatchewan as it invests in their communities and their families, and it most certainly invests in healthcare, which is top of mind to each and every one of us right now. It also invests in the question that is on Saskatchewan people's minds, and that is who is best to foster the economic recovery in this province. This budget is part of our answer to that question, and there will be much more discussion on that in the months ahead as we lead up to an October 26th election in this province.
You have a follow-up, Lisa?
Yes. Mr. Miley has said a few times that you and the Sask Party didn't want this session to happen these last 3 weeks here. Is that accurate?
No. No, that isn't accurate at all. It's always been my desire to introduce and pass a budget here in this province on behalf of the people that we represent. It's always been my desire to pass our legislative agenda if possible, and we're thankful we're able to do that. And I would take this opportunity to thank the House leaders on both sides of the House for the hard work that they did in putting this session together. They both deserve credit.
We'll take one more caller on the line.
We have Brian Inez with CBC.
Hi there. Sort of just following up again on Lisa's questions. I mean, what's sort of the most challenging aspect of the last few weeks for you in this short sitting?
The most challenging aspect is not having everyone in the House, for sure. We all work together, and we weren't always together. Even our caucus meetings were divided up into a number of rooms, and then we video conferenced, and it's staying in touch, but it's most certainly doing it differently, and it's just not the same. It's just not the same as it normally is, and I think that's a very small inconvenience, if you will, when we talk about the inconveniences that so many other Saskatchewan people are going through. Case in point is the announcement that we're making today to open up some of the restrictions around visiting our family members in long-term care homes. But most certainly it was a different session, and I found that challenging, not to have the same camaraderie and everyone around all of the time, and that's, I guess, that's the normal that is here for the time being.
You have a follow-up, Brian?
Yeah, this one sort of, again, following up on Lisa's question about Mr. Miley. I mean, he's also pushed for a possibility of a September session. Are you opposed to that because you've accomplished what you've wanted here? I guess, what are your grounds for opposing another sitting here in the fall?
There's no need. We have passed a budget in the province. We have completed our legislative agenda. There will be a new legislative agenda by a somewhat new government, either the Saskatchewan Party or likely the NDP, maybe someone else that I don't see coming at this point in time, but they will have a new legislative agenda to introduce in a new legislative sitting. So the debate that we're going to have in the months ahead is not going to happen in the legislature. It's going to happen in the communities, on the doorsteps, and in front of the people of this province, and they will ultimately choose who will form the government on October the 26th.
And that's all the time that we have. Thanks, everyone.